Our group researched autism spectrum disorder. In this video, we are going to go over the risk factors. From our research, we identified these as the most common risk factors: antidepressants, vaccines, air pollutants, alcohol, and maternal age. Antidepressants are a possible risk factor due to some mothers receiving prescriptions for their depression during pregnancy. All types of antidepressants are able to cross the placental barrier and therefore can affect the fetus. This shows that antidepressants taken by a mother will directly affect the baby. This exposure to antidepressants could be associated with autism through genetic or non-genetic pathways. In addition, studies done on animals in utero exposure to antidepressants has been associated with autism-like behaviors in these models. Therefore, it is possible that there could be similar outcomes to antidepressants in the use in humans.
Air toxins are present all over the world and can be produced by vehicles, factories, and power plants. Some of the pollutants are carefully monitored by the United States, but other air pollutants are not. According to Kalkbrenner, some suggested causes of autism include environmental chemical exposures that occur during rapid brain development during pregnancy and early postnatal life. Therefore, these chemicals in the air could have an effect on the fetus's early development of the brain. Up until July 1999, some vaccines contained thimerosal, which is composed of mercury. Mercury is a neurotoxin that has increased evidence on a link between it and developmental disorders, specifically autism. Prior to the recommendation to remove thimerosal from the vaccines contained elevated levels of mercury. This neurotoxin could possibly create a genetic deformity within the child if the elevated levels of mercury enter the infant's bloodstream. There was a study done by Wakefield that states that the MMR vaccine caused autism. This study was invalid based on the unethical selection of participants and misrepresentation of the results. This study frightened the public because of the conclusion of the results. This study suggested that the gastrointestinal and developmental symptoms of the participants who received the MMR vaccine were correlated with the diagnosis of autism. Although previous studies, such as the study by Mrozek-Budson et al., have found that the MMR vaccine has no association with the diagnosis of autism.
There have been previous studies that have found a link between high prenatal alcohol exposure and neurodevelopmental effect, specifically decreased intellectual ability, hyperactivity, motor skill impairments, and learning difficulties. These behaviors that are associated with the mother drinking during pregnancy are similar to behaviors associated with autism. Therefore, there could be an association between alcohol use by the mother during pregnancy and the diagnosis of autism in the offspring. Maternal age has been shown to have an effect on increased diagnosis of autism within offspring. This risk factor could be due to chromosomal changes, changes in reproductive technologies, pregnancy complications, or environmental exposures in the mother. Therefore, these issues could lead to increased risk of diagnosis of autism.
ASD can be difficult to diagnose since there is no one test, such as a blood test, designed to determine if someone has ASD. Rather, an ever-changing checklist is used. The incidence and prevalence of ASD in the United States has been steadily increasing over the years. This increase could possibly be due to the constantly changing criteria associated with the diagnosis of autism spectrum disorder.
Autism spectrum disorder, or ASD, is a very diverse condition, affecting people in many ways from mild to severe. ASD is an umbrella term that includes the conditions autism, Asperger's syndrome, childhood disintegrative disorder, Rett syndrome, and an unspecified form of pervasive developmental disorder. The first time autism was formally regarded as a spectrum was in the DSM-IV, which referred to autism as including 5 separate conditions. Now, the DSM-5 says all 5 conditions are categorized under the same umbrella of autism spectrum disorder.
Children with ASD are more likely to be male than female. The results of one study found that females and males responded differently in several categories, specifically drawing, self-injury, reciprocal social interaction, imaginative play, and repetitive behaviors. Males respond differently to these categories, which may represent the increased prevalence reported due to a standard instrument that does not account for gender differences.
We hope that this video gave you a chance to learn a little bit more about autism spectrum disorder. Thank you guys for watching.